Would you like to know more about Pentax Medical's commitment to infection prevention? Read more about our hygiene commitment on our website.
Monique is Product Marketing Segment Leader, ERCP at Pentax Medical, so she's an expert at this topic. So please, Monique, feel free to start your presentation.
Thank you very much for the nice introduction, Marley, and also for all the other speakers for such valuable content so far for our hygiene event. And good morning, good afternoon, and good evening to everybody from all around the world. I hope that you're enjoying our hygiene event. And as Marley mentioned, my name's Monique Dalton, and I'm the Product Marketing Leader for ERCP and Hygiene Solutions in EMEA. And it gives me great pleasure to introduce our last and fourth of our breakout session of our hygiene event about infection prevention. And I will give you an outlook on products and innovations. So we all know that the world population is growing, and of course, predictably, it will continue to grow. And so with these increasing global populations, we have an increasing demand on medical care, and combined with limitation in healthcare expenditure, closer collaboration between you as healthcare providers and also we as the medical industry is really needed. And what we've known so far is that this collaboration is proving to be very beneficial, as it has and will continue to pave the way for innovative technologies to deal with these issues. And the overall aim is, of course, to minimize the risk of infection and improve patient safety. So, of course, we have a mission here at Pentax Medical, and our mission is quite simple. It's really to standardize or improve, let's say, the standard of care and healthcare delivery. And Gilles introduced this triple aim very well in his presentation. But, of course, we want to ensure that we continue to follow and achieve this mission. And we do this by focusing on improving outcomes, clinical outcomes for the patients. We're supporting yours and your patients' needs, of course, and enhancing the productivity. And what this means is that every new product development that we do here in Pentax is always assessed against these triple aim needs. And of course, to ensure that all upcoming products and product enhancements are designed for this purpose, we have what we've devised as the black box innovation. And through this, we work closely with you, our partners and experts in the field, by inviting you very early into the product development phase. And the overall aim here is to understand your unmet needs and challenges in your daily and clinical practice in order to partner with you to continually and constantly innovate and provide solutions. And overall, we want to contribute, of course, to patient safety and improving clinical outcomes. So this is really the direction that we are ingrained and embedded with us. And of course, at Pentax Medical, we are committed to addressing the medical device hygiene challenges. And we do this by offering innovative products, optimizing processes, and partnering with you to set new standards in hygiene. And we're really confident that together we can directly tackle patient safety and infection prevention. And the best part is that now you have the power of choice to select the best solution for your patients. So I can hear some of you thinking, power of choice. You can give us the power of choice from one partner. Well, yes, right now we as Pentax are your partner and are the only ones that can give you currently the power of choice to choose between the solutions to really give you the best solution or technology in order to treat your patient in the best way possible. And right now we have our reusable endoscopes, our semi-disposable endoscopes, and coming soon we will also have our single-use endoscope portfolio. So this is just one focus point for us with our hygiene commitment. And I also mentioned about processes. And as Marion Duparterre nicely explained in the breakout session from earlier this morning, is that the time dedicated to manual reprocessing steps is much, much less than what's needed. So I think we're averaging around 6.5 minutes compared to 25 minutes that's required. And Paul César, in his first breakout session, also touched on this point, as well as highlighted the importance of training as a core competency. And as part of the extension of our hygiene commitment to you and your patients, we are, and we're continuing to work with you to optimize reprocessing outcomes through updating documentation, for example, or providing training in order to minimize the impact of human factor and ultimately improve endoscopy hygiene outcomes. And last, but surely not least, is the people. Partnering with you, our customers, our partners, our experts in the field through events such as today's hygiene event, online webinars, hygiene exchanges, partnering with key scientific societies such as IGNA, and together we really feel confident that together we will improve the hygiene standards and really drive change together. And the main aim, of course, is to minimise the risk of infection. We want to improve the processes and form strong partnerships so together in all fields of endoscopy we will support this holistic approach together. But overall, both you and your partner are our focus, and you now have the power to choose the right solution for each and every one of your patients by choosing the best partner to provide the right technologies depending upon your needs. So what we have, of course, at the moment, I mentioned already, is our reusable endoscope portfolio. And you already know that we have a very well-established design. We have state-of-the-art procedural performance and best therapeutic intervention capabilities. So, for example, you might choose a patient who's going for a routine or standard procedure where best-in-class imaging and also strong therapeutic intervention performance is required. Or perhaps maybe your hospital management or procurement is quite focused on budget, and the clinicians are focused on imaging quality, and together then a nice compromise of a solution would then to be selecting the reusable options. So extending this choice to you further, we also have our semi-disposable endoscopes, and this introduces all of the benefits of the reusable scopes, in addition to increasing the prevention of infection due to the single-use hygiene disposables. And for the semi-disposable endoscopes, we're really addressing the three main key areas of infection risk on the endoscope, so the distal end, the elevator, and the valves. And you might choose, for example, to use this semi-disposable scope option for an ERCP procedure, where you can use the disposable elevator cap or our deck, and in addition with our single-use valves in order to minimize the risk of infection and reduce the risk of contamination. And what's even nice is that an additional choice for you, giving you the power of choice to choose further, of course you can couple both of these solutions with our endoscope drying and storage solution, which Daniel already nicely introduced in his previous breakout session. And from this we know that completely drying the channels is important also in the reprocessing procedure, and we're really preventing the formation of biofilm. In addition, we can guarantee an aseptic environment in which to preserve the endoscope's disinfected state, as well as providing a secure transport system or reservoir where the endoscope can be transported from point A to point B. And we found that this was actually quite valuable during the heavy COVID periods at the beginning of this year, and will continue to also add value to our clinicians during extension of COVID. So, of course, I'm sure you're all very interested to know more about our single-use solutions. And coming soon, of course, as part of our Pentax Medical One series, in order to support you with your urgent or critical treatment needs for specific patient areas, we're providing you the additional or further power of choice. And I already mentioned COVID. It's a hot topic at the moment, but we've seen the trends during the COVID periods more towards the use of single-use devices in order to support your decision to use these on the patients. And as a first step in our One series, we have addressed the need in bronchoscopy, and which of course we developed in partnership with you in our Black Box Innovation Program. And we're confident that our range of endoscope solutions with our reusable, semi-disposable in combination with our plasma typhoon and plasma bag system, in addition with our upcoming single-use solutions, will give you more choice and give you more options in order to treat your patient in the best way possible. So, due to your valuable feedback so far, we talked already about Black Box Innovations. We have created already some nice innovations for you to give you solutions to your challenges that you're facing in your daily practices. So the first one I mentioned already is our disposable elevator cap. But of course, this comes with a duodenoscope. So we launched our DEC video duodenoscopes. And we've seen in much literature that normal or conventional duodenoscopes are, let's say, can be linked to infection risk, and despite proper reprocessing and ERCP procedures. And in a recent publication, the FDA released, they recommend the transition to duodenoscopes with disposable components in order to reduce the risk of infection. So, responding to the FDA's evidence base to improve the design of the duodenoscopes, we launched this DEC high-definition video duodenoscope with a disposable elevator cap. And the benefit and, let's say, the uniqueness and the innovation of this is that we have not only a disposable cap, but the elevator, another source of a potential risk of infection, is also provided with our DEC cap. And as I mentioned, it represents significant clinical innovation both in device design and patient safety. It simplifies reprocessing and safely removes one of the most vulnerable components of enteric bacteria within the device. And this is a major step towards reducing the risk of infection in our endoscopy field. And the second innovation introduced increasing patient safety is the plasma typhoon and the plasma bag system. And in 2018, Daniel touched on this a little bit, but in 2018, Pentax Medical acquired a major stake in plasma biotics, and this was really beneficial that we now have in our portfolio a system supporting the hygiene management for endoscope devices, which of course also helps in the reprocessing area to improve efficiency. And there's been a lot of publications on the importance of drying, and Julio Kovaliva stated that in order to maintain endoscopes disinfected state, complete drying is absolutely necessary. And we can dry a scope completely, the channels in the scope, in 1 to 5 minutes. And we're using active storage in the plasma bag to ensure the disinfection state of the endoscope. And this additionally allows for transportation from one place to the other. In addition, we have our hygiene consumables, of course, and coupled with our semi-disposable endoscope options, improves our safety and improves the efficiency. So Paul mentioned in his presentation this morning how many steps are really needed to clean a reusable valve, and it's actually astonishing. And with our hygiene consumables, we're able to take away this risk due to inefficiently cleaned valves in the endoscope. In addition, we have our Pentax Medical single-use brushes, which are also a vital step in ensuring infection prevention. And what we're addressing here is the channels. So we're ensuring that another area of infection risk of the endoscopes, which is the channels, is really addressed by our hygiene solutions. And last but surely not least, our hygiene pack, which we will soon be launching. This is a combination of the most important single-use consumables for ERCP. So we have a box that goes into the reprocessing room, which is our single-use brushes, compatible with Pentax scopes in order to ensure no damage to the endoscope channels upon reprocessing. And also we have our disposable elevator cap and single-use inlet seals in the hygiene pack to go into the procedure room. So in summary, a lot of information to absorb, I know. So in summary, the DEC duodenoscope and Plasma Typhoon and Plasma Bag system are just two of our innovative solutions which bring a major contribution to the reduction of risk of infection in some of the major areas of concern of the endoscopes. And this is due to the innovative design, of course, of the DEC, to our single-use consumables, and the fact that we can guarantee complete dryness of our endoscope channels and active storage in the plasma bag for up to 31 days. And additionally, our hygiene consumables, including the brushes, and the hygiene pack, provide you convenience and improved efficiency to your workflows. And we enjoy working with you and will continue to work together with you in partnership to ensure all of our products are based on direct feedback from you in order to innovate the right solutions so you can treat the patients in the best way possible. And we're constantly innovating, and our hygiene commitment, we believe, is really nothing without action. So I guess you're wondering what is next on the horizon. Oh, sorry, I can hear an echo. So I guess you're wondering what is next on the horizon. So we will continue to extend your power of choice through our upcoming and future innovations in order to overall improve patient safety. And we're extending our portfolio of single-use endoscopes for emergency or critical situations for you to extend your power of choice again. In addition, we incorporate single-use components. So already we have the DEC cap for our video duodenoscope, and we will continue to innovate to expand this to other endoscopes in our portfolio. We're also looking at improving reprocessing outcomes, or continuing to improve reprocessing outcomes through faster drying in order to prevent biofilm formation. And also we have and will continue to listen to your needs to collectively understand which solutions you need in the market for us to continually partner with you to innovate solutions for the future. So as part of Pentax Medical Hygiene commitment, we'll continually work on providing these solutions for you in order to give you always the power of choice from your partner. And with this clear vision in mind, we will continue to work on enhancing our products and services as well, from screening to diagnostics to therapy, in order to minimize the risk of infection and ultimately optimize patient care with you, our partners. So thank you very much for your attention, and extended thanks from us and all the team for your work on the front line during these COVID times. And I would like to open up to, if you have any questions, I would be more than happy to answer them. Thank you very much.
Thank you, Monique, for this very clear outlook on what's still to come and what is already there to improve infection prevention in endoscopy.